So good evening. We are doing part 2 from impression materials today. To start with, we'll go very quickly through the slides from last lecture. Did anyone read the chapter from Philip's book? No? All right. Definitions, there is no need to go through them. The ideal material should be, we said that should be accurate, viscous enough to stay within the tray, but very flowy to capture all the details. It should be easy to handle, fast setting, and with adequate working time. It should adhere to the tray. It should be, when it sets, elastic with adequate tear strength, and it should be dimensionally stable and preferably to be able to pour it multiple times. It should be hydrophilic and with low cost and acceptable taste and odor. We went through this in details. Last time we covered inelastic materials, which are impression compounds, zinc side, impression plaster, and impression waxes, and then the elastic materials, which we'll cover part of them today, and we covered hydrocolloids last week. The main feature regarding inelastic materials that it can be used to record undercut because they are rigid. Impression compound is a thermoplastic material, so it doesn't react chemically. It's only a physical setting or a physical reaction. The two types, type 1 and type 2. Type 1 is the one that's used for impressions. Type 2 is used to make or construct an impression tray. We said that the yeah.
ترى شو الفرق بين الامبريشن كومباوند والامبريشن واكسي؟ الاثنين ثيرموبلاستيك.
امبريشن كومباوند وايش ثاني؟
والامبريشن واكسي.
اثنين ثيرموبلاستيك. ثيرموبلاستيك هي بروبرتي للماتيريال. امبريشن واكس فيها بس واكس. الامبريشن كومباوند فيها اشياء ثانيه غير الواكس اللي هي الرزن.
تمام شكرا.
Alright. So we said as soon as you take the impressions, preferably to pour the impression right away with impression compound because it will undergo some dimensional changes because of the internal stresses which will be released as you take it out of the mouth, and the three factors that are causing the internal stresses. Zinc cyanogenol is the one that's used for a secondary impression for an edentulous patients without undercuts. It's supplied as 2 tubes and undergoes an acid-base chemical reaction, so it's an irreversible material. It has a very good dimensional stability and it's rigid on setting, so it shouldn't be used with undercuts. Impression plaster, we don't use it much nowadays. The only indication to use it is when you have flappy tissues, but because the cast will be poured in gypsum and all of the special considerations or the problems with gypsum, we go to with using silicone nowadays. Impression waxes are mainly used just to correct small defects in your impression, most probably never to be used to take a complete impression. Hydrocolloids, we said hydrocolloids because the other component is water, and there are two types, the agar-agar and alginate. Agar-agar is the reversible one. Last time I think I said the first water bath, the one on the right, actually it's on the left, and the temperature is in Kelvin and not in Celsius. So it should be around 100 Celsius when you soften the material, then you store it within the 70, and then you temper it down to 50 just before taking the impression. The fact that it's reversible doesn't mean that it's reusable in the patient mouth because of the cross-infection contamination problems. So it's mainly used in labs nowadays. And plus because of the high cost, because it needs special equipment and the water-cooled tray. Alginate, the material that you use the most on your clinics. It's applied as a powder. You need to mix or you need to shake the bag before scooping out your powder, because the fillers, which are heavier or more dense than the other components, will recede in the bottom. So you need to mix it to have a uniform powder. Use the same powder to water ratio as manufacturer instructions, and if you want to regulate your working time and setting time, change mainly the water temperature. Okay. Someone asked me about the reaction. So first of all, when we mix the water with the powder, the retarder, which is the sodium phosphate, will react with calcium sulfate, which is the other component of the potassium alginate main reaction. So once we consume all of the retarder or the sodium phosphate, the calcium will start reacting with the potassium alginate to produce the final calcium alginate impression material. So this way they regulate the setting time and classify the material as a fast set versus slow set according to the amount of the retarder within the impression or within the powder. The other thing about hydrocolloids in general, and mainly about alginate, is because they are hydrophilic, they can either gain water or give up water. And the two terms used for these descriptions are synesis and imbibition. So when you disinfect your impression, you shouldn't immerse it in chemical disinfectant. You just spray it with the disinfectant and wrap it with a damp towel sheet or piece of tissue and keep it stored and send it to the lab to be put. This is the technique that I mentioned, just for you to know. Someone asked last time about the primary impression and secondary impression, especially in stock trays. We said the stock tray is the one that's prefabricated, the one that is made in the factories, and then they send it to you to your clinic with different sizes. You choose the most appropriate size to your patient, and then you take your impression. Here we can say the stock trays that are used with dentate patients. You can see there is more space to accommodate the teeth. This one is for the upper, and this is for the lower arch. On the other side, these are the ones that are used for edentulous patients. They are shallower because we don't need that much height, and they are made of some sort of metal that is a little bit malleable, so you can change its shape a little bit. I think you'll be using the same set next year in the lab and the following years in the clinic. Special trays are the one that are fabricating after taking the primary impressions. The lab will have a cast, your primary cast, and then he can fabricate a special tray that is custom made to this patient according to the shape, and it will provide a uniform thickness of the material. So you will use much less impression material, and it will be uniform in thickness all around. This one are for completely edentulous patients, for example. This one we use it for implants. We have space for the screw for the implant when you have an open tray technique. This one is a perforated one, mostly around teeth. In certain cases, like with patients with microstomia, where we have a small mouth or a very limited mouth opening, you won't be able to insert the tray as a whole. So in this example, we have a sectional tray. So we have a tray that is fabricated in two pieces with some relocating pins. So you insert the first part into the patient's mouth, then you insert the second one You take the impression, and then when you take them out, you take them one by one, and then you assembly the two parts outside the patient's mouth. Okay, just something to note or to keep in mind for later on. I can't remember who asked about undercuts and tried to explain it with my hands. I think I didn't do a very good job, so I got some pictures here. In this photo, you can see that there is an area highlighted in blue. This is an area that we call an undercut, while on this side we don't have any space below the line. So in this example, we want to use a rigid material to take an impression. Same goes for the edentulous areas where we have an undercut within bridge, as you can see in here. All right. If you compare this side to this side, we don't have any undercuts while we have one in that area. All right. And same applies when you have a periodontitis case and we have recession of the gum. We will have these small black triangles in between the teeth where the impression will flow, and if it was rigid, when you try to take it out, it won't be able to tear or rebound from this undercut, and you might even extract some of the teeth when you try to pull it out. All right. Surfactant, we already mentioned that if we prefer a hydrophilic material when we pour our impression and when we take our impression. But question? Okay. But when we have a hydrophobic material, such as the synthetic elastics, which we will talk about in a bit, when we take our impression, we use the surfactant to reduce.
دكتور كأنه صار لك ميوت أو
آخر إشي سمعتوه؟ Can you hear me now?
دكتور آخر شيء ما سمعنا شيء تقريبا من السيرفاكتنت.
كنا بنحكي عن الاندركت.
خلصنا اندر كاتس بس السيرفاكتنت ما يعني بس بلشت تحكي انقطع الصوت.
So the surfactant, we said we use it with hydrophobic materials. When we pour our impression, the plaster which is used to produce our cast is a hydrophilic material and it contains water. So if we have a hydrophobic material, it won't flow and capture all of the details of your impression. So you use this surfactant or the depopularizer to reduce the surface tension of the impression material. So when you pour your gypsum material, it will flow and produce an accurate cast. Engineered setting reaction, already mentioned that. Disinfection, as I said, you spray it with the chemical disinfectant instead of immersing it within the material, and then you wrap it with a piece of tissue and you store it in a bag for like 10 minutes or so, and then you rinse it again, store it with another damp tissue and send it to the lab. Anyone got any more?
Doctor, please can I ask a question? Doctor, you are mute.
You have been muted. Someone is muting me. Okay. لما سألت على any other questions?
Yes, doctor, can I ask?
Yeah, go on.
Doctor, what is the difference between alginate and agar-agar in disinfection?
They are the same because they both are hydrocolloid. They both hydrophilic materials. So when you disinfect them, you need to be extra careful. So it's a general consideration.
I read from Google in advantage of agar-agar. It's disinfection easily.
No, it's the same. Because they are both hydrocolloid, they both contain water, they are both hydrophilic material.
Okay.
Okay. Any more questions? All right. Shall we start with part 2 now? So we have covered the inelastic and the hydrocolloids. And now we will talk about synthetic elastomers. Synthetic elastomers are mainly made to overcome the problems with hydrocolloids, which are the dimensional instability because of gaining and losing water. So we have 3 or 4 materials: polysulfide, polyether, and silicon, the C silicon and A silicon. Actually, all of the synthetic elastomers are supplied in a two-phase system. One of them is the base, the other one is the catalyst. Upon mixing, the reaction will start. All of them are react chemically, and they are irreversible materials. They will have different consistencies. So you have the extra low, low, medium, and heavy and putty consistency. It depends on the filler amount. Remember last time when we talked about alginate, we said that the filler is what gives the material its mass, what gives the material the body. So in here, the different consistencies, the main difference is the amount of the filler. The extra low or the low or the large body's consistency contains the least amount of filler, and the putty will contain the highest amount of filler. First one is polysulfide. It's commonly called rubber impression material. We don't use it anymore because of the bad odor and the relatively dimensional instability. It's supplied in two-phase system, almost similar to zinc cydigenol, but each material will have a different pore diameter or different size. So when you milk out the material out of the tube, you will have equal length but different thicknesses, and this is what makes the material react in according to the proper catalyst to base ratio. So you'll have different amount or different amount by weight, but it's equal in length. When the polysulfide reacts, it reacts through a condensation polymerization reaction. So you have two material. The two material, when they are reacted together, they will have a shorter or less weight, and that means that we will have a byproduct, meaning we will have dimensional instability or a bit of shrinkage upon setting. So the thing that you need to remember that sets by condensation reaction, water is the byproduct in polysulfide, and that's what causes the shrinkage or the dimensional instability. The other thing to keep in mind that the catalyst is the lead dioxide, and that's what gives the catalyst phase its color. It's a brown in color or brown blackish in color. The base is white. The other thing that the catalyst tube will contain sulfur, and this what will give the bad odor for polysulfide, plus it will stain the cloth. So in summary, advantages and disadvantages of each material: polysulfide will have a long working time with high tear strength, and it's relatively cheaper than other types of elastomers. But on the other side, it has a very long setting time. It will if it was stretched beyond its elastic limit, it will be distorted. It's messy to handle, its taste and its odor is obnoxious, and it should be poured right away because of the dimension instability. Plus, it requires custom trays. Why do we need custom trays? Because we have lots of shrinkage, and when we have a custom tray, we will have less material and with more uniform thickness. So the effect of shrinkage will be a little bit less on the accuracy of the cast. While if we use a stock tray, in one area the impression material will be like 4 or 5 millimeter in thickness. In other areas it will be 1 millimeter in thickness, and the shrinkage in the area with the more material it will be more, so the impression, the cast itself will be more distorted than if it was in uniform thickness. So if you use a material which has shrinkage, or it will shrink upon setting, it's preferably to use a minimal amount needed, or with the minimal thickness of the material needed. That's why you will need a custom tray with polysulfide, and later on when we talk about the light body silicons. Okay? Anyone got any questions so far? Can you all hear me? Okay. The other synthetic elastic material is polyether. The most common material that you'll come across is called Imprigum. It was founded in like 1970s or so. The main advantage is polyether. It's less hydrophobic than all other elastomers, so it's the most hydrophilic material of them. It's less than alginate or agar, but it's very forgiving in terms of moisture control. So if there was a little bit of saliva or moisture or humidity within the mouth when you take your impression, you won't have lots of air bubbles within your impression. Okay. It was only made in one consistency, the medium bodied consistency. Nowadays we have two consistencies, the medium body and the light body as well. Okay. If you can see in this area, we can see like a little bit of red material. When we use polyether, we need to use an adhesive, because the polyether, it won't adhere to the tray, even if it was a special tray. So you need to use a specific tray adhesive to make sure that the impression material won't separate from the tray. Okay, and that was this red color. The reaction, or the setting reaction of polyether, is a ring opening polymerization reaction. So there is a ring, I think it's called Rhizine ring. No, it's already written. Azardine ring. So upon reaction, it will open this ring, and then the material will react with another material from the right side, another one from the left. And we don't have any byproducts that make it very good in terms of dimensional stability. The other problem with polyether, or the main problem with polyether, because it's a little bit more hydrophilic, it might gain water or release water as well, or actually it just may gain water. So it shouldn't be stored in a same bag with an alginate, because if you store an alginate impression of the opposing arch with the working impression that was taken in polyether, the water will go out from the alginate, and it will be introduced into the polyether and make both impression dimensionally inaccurate. So you need to store each one in a different bag. Plus, you need to be extra careful. You need to be careful upon disinfection polyether. you will disinfect it in the same manner you did with alginate. You spray it with the disinfectant rather than immersing it in the disinfectant. Because there is no byproducts, in theory, you can store it indefinitely, but because of the water problem, it should be poured within 48 to 72 hours. Okay, so it's more accurate if you pour it faster or right away. Advantages: it's fast setting and it's supplied with an auto mix tip, so you'll have a better consistency of the material when you dispense it. As we said, it's the least hydrophobic or the most hydrophilic of other elastomers. It has a very good elastic properties with adequate tear strength, and it's stable. You can delay pouring. Disadvantage: it's the most rigid of these elastomers. So if you have undercuts or, as we say, the periodontally involved teeth with lots of dead spaces or the black triangles. So with black triangles, ideally it shouldn't be used, and if need to be used, you need to block these undercuts with wax or with some other sort of material. It doesn't taste as good as silicons. It has a bit of better taste, but it's better than or more better than the polysulfide. It absorbs water, so it's dimensionally unstable if you didn't be careful upon storing it or upon disinfecting it. Plus, it's higher in cost than polysulfide and silicon. Polyether. Anything else to mention about polyether? We will mention one other property about polyether. It's called thixotropic. So when material is under shear strength, under shear forces, when you press the material under pressure, it will flow a little bit better. I don't have a picture. But when it's within the tray, it will hold itself within the tray. So it has the high, I won't say it's some sort of viscous material within the tray, but when you have it in a syringe and syringe it around the teeth and then place it inside the mouth, it will be more flowy and lighter in consistency than the material that is within the tray itself. We will go through this in a bit when we talk about impression technique. The last type, which is silicons. Silicons are of two groups or two types. The condensational silicon or C-silicon, which is called type 1, which was founded before, and then the newer silicon, which is the type 2 or additional pure silicon. It depends on the reaction. So condensation reaction, it's called C-silicon, so we'll have a byproduct. Additional reaction, we won't have a byproduct. Okay, they are founded in different consistencies, as we have already said before. In this example, we have two material. The green material is the heavy or the putty material, and then we have another lighter material, which is orange in here. When we have lots of filler, meaning that we won't have lots of polymerization shrinkage. On the other hand, the light body material or the extra light body material, because we don't have lots of filler, we will have a higher polymerization shrinkage. That's why we used the putty to take most of the space, and then we have the minimal amount of the light body in order for the shrinkage to be to the minimal to have a more accurate impression. Okay. If you took the whole impression in light body silicon, it won't be as accurate as in taking it within the two consistencies, putty and light body. In general, most all of the silicons are hydrophobic. They have the best elastic property, so they can rebound out of the undercuts the most, and they have a very good teeth strength. They taste much better than polysulfide and even polyether. They are not toxic, just like any other material. C-silicon, we said they have comes in two putties or two base system, the base and catalyst. They react through a condensation reaction, and we have a byproduct, which is ethyl alcohol. In polysulfide, we had water as a byproduct, and in C-silicon, we have ethyl alcohol as a byproduct, which is accompanied by shrinkage, and the dimension stability of dimensional changes is a little bit more than polysulfide, but it's better than alginate. These are the components of the two putties, but you don't need to go through them. When we mix it, this is an example of one material. This one is the putty, which is almost like a plain dough. This is the catalyst tube, and this is the light body tube. When you mix the putty, you take the measure in order to respect their ratio as their instructions. You have the shape of the scoop, and you use two lengths of the catalyst. While when you have the wash, you pour equal lengths of the material, and as you can see, the light body material is thicker than the catalyst. So in terms of weight, they will be different, but in terms of length, they should be the same. The advantage of the C-silicon, that they have a putty to customize the stock tray in order to minimize the amount of light body used to record a proper impression, and with less polymerization shrinkage. They are clean and pleasant. They taste well, and they don't stain the clothes. They have good working time, and the preparation margin can be seen easily. The disadvantage of C-silicon is the high polymerization shrinkage because of the byproduct, which is ethyl alcohol, which is volatile. They have a low tear strength, and they are hydrophobic and should be poured immediately. On the other hand, A-silicon is much better and the material of choice in almost every aspect of dentistry nowadays, in implants and in crown bridge work. In this photo, we have different types or different consistencies. This is most probably the one that we can be used with the machine. It's a medium, or actually heavy or medium body silicon. These are the tips that's used for it. This one is the light body silicon. These are the automix steps with these small nostrils that is used to syringe the material around your prep. Okay, so you'll have less chance of air entrapment. This is a syringe that can be used or filled with the material, and then it can be used in the patient's mouth. This one is the putty consistency. It's coming in two jars, just like the Play-Doh as well. You mix from the base and catalyst. And then this is a different type of adhesive that is used for A-silicon. So A-silicon and polyether, they have their own adhesive. It's not the same adhesive. Each one should be used when you use it with the before taking the impression. You should coat the tray with the adhesive before taking the impression. Okay. We have two pastes. One of them is a paste, the other is the catalyst. The catalyst in A-silicon is platinum salt, and the base contains polyvinyl siloxane. Okay, and this is the other name for A-silicon, PVS, polyvinyl siloxane. When they react together, they react through an additional reaction, so they don't have a byproduct, but hydrogen gas will be produced, and this it won't cause any inaccuracies in the or dimensional changes in the impression, but it might cause some bubbles if the impression was poured right away. The newer material of A-silicon, they have palladium added to act as a scavenger for hydrogen, and this is why the A-silicon is the most expensive impression material, because of the addition of palladium. So they have a better dimension stability than C-silicon, and they are a bit better in terms of tear strength and stability. That's almost like C-silicon, same advantage and disadvantages, but because they have better tear strength, they can be put more than once. Okay, most probably when you have a C-silicon, when you take the impression out of your cast, it will tear a little bit. Okay, the A-silicon is slightly better. We said it's a hydrophobic, so it won't flow into the sulcus if it wasn't dry. So you need to make sure that your field is dry when you take your impression. You should be careful when you pour your cast. You will need to use the surfactant. You should be careful when you disinfect your impression. Disinfection with polyether. You can disinfect it normally by immersing it in the chemical disinfectant. All right. Latex gloves contain sulfur, and sulfur might inhibit the reaction of A-silicon, although recent studies shown that it won't affect it that much. Even when we use a hemostatic agent, it might contain sulfur and might interfere with the setting reaction of A-silicon. So preferably, when we use A-silicon, make sure that you use latex-free gloves, and make sure that you rinse the area very properly, very thoroughly when you use a hemostatic agent. There's new material in market now called smart silicon or smart A-silicon. Basically, it's a hydrophilic additional reaction silicon. It has a good dimension stability, high tear strength, and resist permanent deformation. It's not that smart because all what they have added, they added a surfactant within the material, so it can be a little bit more hydrophilic than the A-silicon, but still it's not as hydrophilic as polyether, and still not as hydrophilic as the hydrocolloids. Okay. Any questions about impression materials so far? All right. The last two small topics we're going to talk about: the manipulation of the impression and the impression techniques. The materials such as zinc oxide, such as polysulfide and C-silicon, they came in two tubes system. So you dispense the material in equal lengths, and then on a glass slab or on a piece of mixing paper, then you mix them by hand using a spatula to produce the impression material. Usually they have two distinctive colors. One of them is white, the other one's red. One of them is black or brown, the other one is white. So you keep on mixing it until you have a homogeneous mix, so you make sure that the ratios are proper. Okay. The other technique, which is the preferable technique nowadays, the other two techniques are the static mixing or the dynamic mixing. The static mixing, where you use this gun, this sort of gun will have a small plunger that it will push the material out and will go through this auto mix step. It will have like some sort of a hilux in there. The material, when it goes out and the first few millimeters of the tip, it will have two distinctive colors. In this example, white and orange. And then all the way towards the end, it will be very homogeneous with the same consistency. Okay. It's preferable than the hand mixing, because every time you mix the material, you will have the same or the proper paste to catalyst ratio. and you will have a more consistent, more homogeneous mix every time. The dynamic mixing is the same concept, but it's use an automated or a machined plunger instead of you push it by your hand, and it's mainly used with heavy and medium body silicons or consistencies of silicons and polyether, because they will require a little bit more force when you use the manual gun. Okay. Believe me, it's very hard to dispense a heavy consistency using a handgun. Okay, techniques. We have 3 or 4 techniques. The first one is the multiple mix technique, where we use 2 consistencies or 2 viscosities at one time. Mainly, we will be using heavy or medium body plus light body and or extra light body. So within the tray, you load the tray with heavy body material or with medium body material, and then with your gun, you will have light body or extra light body. Usually, you as the dentist, you will syringe the material or use the gun to dispense the material around your preparations in the mouth, and your nurse will mix the putty or the heavy body and load the tray. And then before the light body starts to set, you will insert the tray on top of with the medium body material or with the heavy body material. You will insert it on top of your light body in the patient's mouth and wait until they sit both together. Okay. The other technique is to have a monophase or one viscosity, which is usually a medium body material, and it's mainly used with polyether. So within the syringe, your nurse will fill the syringe for you, and then when you apply force on the material, because as we said it's thixotropic, it will flow out of the tip or the nostril of the syringe, and you can use it almost similarly to light body. You use it in the patient's mouth and inside you around your prep, and then your nurse will hand you the tray filled with medium body silicone, the same consistency, and then you insert in the patient's mouth and wait for them to both sit at the same time. The last technique is the putty and wash. It's mainly used with C silicon because of the high polymerization shrinkage. So you load your tray with the putty or with the heavy body. You take an impression, wait until it sets. You take it out of the patient's mouth, and then you use the other material, which is the medium body or the light body. You syringe it around your prep, and then you reinsert the material, the tray with the set putty or heavy body impression over the impression. So you have 2 impressions or 2 impression viscosities at 2 different times. While the multiple mix, or what we call one-step technique, you have 2 consistencies, but they sit at the same time. All right. The putty and wash, nowadays we can use it as a repair technique. So, for example, I took an impression using a silicon, and there was like a small defect around one of the teeth. Wasn't very thorough when I tried my preps, and there was some water or some saliva around one of the finish lines. So I had a defect when I took the impression out, or an air bubble. So I can just cut a small piece of the impression out, then use some light body, syringe it in the air, try the field properly, make sure that's completely dry, use my syringe light body around the prep, and then reinsert the impression again to recapture this small area. Although most of studies show that it's preferably to retake the whole impression, because you can't be sure that you have seated the impression in the same position and you apply the same pressure on the material that you did in the first time. I think that's it. Just a tip for you later on, always keep in your mind the composition of the impression material. how accurate is the material and how accurate you need the cast to be. So for primary impression, I don't need it to be as accurate as when I take an impression for crown prep, for example. You need to know your setting times by heart. You shouldn't take the impression out of the patient mouth before it sets, because it will affect its stability. Even if it seems like it's set material, you need to wait for the setting time according to the manufacturer. Okay, and that's it for today. These are the two references. I've already uploaded them to the files section on Teams. I've uploaded the whole book for Philips Dental Materials and the journal, and the glossary of prosthodontic terms, if you want to go through them at any point. If you got any questions, now, please ask. If you don't and you remember anything later on, send me by email, or actually we can do some sort of a discussion on Teams if anyone got any questions.
دكتور يعطيك العافية.
الله يعافيك.
عبد الله معك. دكتور, can you send us the slides, please?
Yes, most probably I will upload them as well on Teams. Let me double check. Okay, I will either upload them or send them by email to you.
Thank you, Doctor.
No problem. Any questions? No? All right. Can anyone tell me what's the name of the property of polyether that allow us to use it as a monophase impression?